So I'm going to talk about something that is can be very challenging in the emergency department and something that's very common. So good to know, have some strategies and some phrases to use to address it. And that's discharging somebody without a full diagnosis. So the patient that you're thinking, literally the only thing I can put on this person's chart is abdominal pain, and I don't have a specific reason. So when I'm discussing this with patients, I actually have this conversation twice. So I have it at the beginning before I leave the room the very first time after I've done their history and physical, and then I have it again later once all of the test results have come back. So let's say we have somebody come in with abdominal pain, which is very common. So I say, after I've done their history and physical, I'll tell them, for example, okay, so after everything that you've told me, after I've done my exam, the main things I'm worried about is that there might be an issue with your gallbladder because of where your pain is. That's a really common reason to have pain in the top of your stomach. And the gallbladder is an organ that lives up there that can sometimes make stones, and that can cause a lot of pain. But other things that are up in that area that can cause problems would be a gland called your pancreas that can get inflamed sometimes and cause pain. Sometimes people can have stomach lining irritation or get stomach ulcers, and that can cause a lot of pain in those areas as well. But there's a couple other serious things that I don't think are happening, but that can cause the type of pain that you're experiencing. And since you've never had this before, I do think it's worthwhile to get some testing done. So we'll get some blood tests. If I don't have a great explanation after the blood test, I'm probably going to recommend doing a CAT scan, and I'll come back and talk to you about that before we do it. And while we're doing those things, my number one priority is going to be getting you feeling better. So I'm going to get you some medications for your pain and for your nausea to try to get you feeling better while we're waiting for these tests to come back. And just so you know, sometimes what will happen when we send these tests is everything will come up looking squeaky clean and normal. And that's great because it means that you don't have one of these, more serious or concerning issues going on that can make people really sick. So that's good. But sometimes it can be a little frustrating to not have like a very clear answer of like, this is the exact thing that's causing my pain. But I can't always find an exact answer, but my job is to make sure that you're safe, to make sure that there's nothing really critical or dangerous going on. And if all of these tests come back negative, then we'll have done that. So that's what we're going to do. So I'll have that conversation with them. And then later, if everything does come back normal, usually I'll say, all of your tests that we talked about earlier are all fine. Your gallbladder looks fine on the CAT scan and on the ultrasound that we did. Your blood test for your pancreas and all of your electrolytes and your kidneys and your liver, all of those things look really good. Your scan didn't show anything worrying, like a tumor or cancer or anything like that might, that can sometimes worry people. So those are all really good things. I wish I had a better explanation for why this happened, but again, it doesn't seem to be anything serious. So what I'm going to do is send you home with some medicine to help control your nausea, send you home with something to maybe help lower your stomach acid level, because that's something, stomach lining irritation is something we can't see very well on a CAT scan, and it's not a really serious thing, but it is really distressing and can cause a lot of symptoms. So I'll send you home with some medicine for that in case that is what's causing it. And then I for sure want you to follow up with your primary care doctor, or if they don't have a primary care doctor, I'll say, here's some clinic information for a doctor that you can give a call to tomorrow and follow up with. And that's how I do that.